Welcome, everyone. We're going to give it a couple more minutes. People are still trickling in. We'll go ahead and give it about 30 more seconds. We still have a lot of people trickling in. Welcome, everybody. Before we begin, just please note that this webinar is being recorded, and by remaining in the meeting, you are consenting to being recorded. Hi, everyone, and thank you for joining us today. We're excited to walk you through some important hospice process improvements, as well as the new online Medi-Cal Hospice Notice of Election form. This is a big step forward in making things smoother and more efficient for both providers and DHCS. Before we dive in, I'll start with some housekeeping notes. All attendees are currently muted to minimize background noise, but if you have questions during the presentation, please feel free to drop them in the Q&A box at the top of the screen. We'll be sure to address them during the discussion at the end, or if there is no time, we will take all questions back and generate a Q&A document for everyone to reference on our DHCS Hospice information page. Here's a quick look at what we'll be covering today. We'll quickly do some introductions, then start with a brief overview of current hospice policy requirements, then walk through the new online submission process, and then we'll wrap up with a Q&A session. So there should be plenty of time for everyone's questions in the Q&A session. I'll start off with introductions. My name's Nathaniel Emery. I am a health program specialist with the benefits division at DHCS. I function primarily as a project manager for the hospice program and focus on streamlining processes overall for the program. I'll go ahead and hand it off to Erica.
Quick question before I introduce myself. Folks are saying in the chat that they don't have audio. So I was hoping if anyone can hear me speaking right now, if you could type that you can hear us in the chat. Okay, great. Thank you.
Okay,
all right, so
great.
Folks can hear now. Okay, perfect. Thank you everyone for confirming. So I'm Erica Holmes. I am the Assistant Deputy Director for Healthcare Benefits and Eligibility, and I'm also the Interim Chief over the Benefits Division. And as Nate shared, our team is responsible for the hospice coverage and reimbursement policy, and we are also lead on this modernization effort for our hospice notice of election form. Stephen?
Hi, good morning, everyone. Stephen Jang. I am the branch chief for the Clinic Policy and Special Programs branch, which is where this hospice work is being held. So happy to be here, and Nate is going to lead us through this modernization that Erica mentioned. Anyone else?
Florida?
Right.
Can you hear me? This is Florida Kiawit. I'm a nurse consultant for the Clinical Research and Medical Policy Group, and basically focus on hospice policy, but we I also facilitate the hospice work group. So it's a blending of many of the divisions within DHCS that helps to pull this all together. And Lisa, I'd like to introduce Lisa.
Good morning, everyone. My name is Lisa. I'm with the Benefits Division. I'm a staff service analyst, and I am your hospice clerk.
Great, thank you, everyone. So before we get into the new process, let's review current policy requirements. These are the rules and expectations that guide how hospice care is authorized and reimbursed under Medi-Cal. We'll take a quick look at how things used to work in the past. All NOEs, notice of elections, regardless of whether the member was fee-for-service or in a managed care plan, were sent directly to DHCS using the DHCS 8052 form, otherwise the notice of election form. Some providers even used their own versions, which led to a lot of confusion. We saw delays, denials, and a lot of back and forth because forms were routed incorrectly or missing key info. So why are we changing it? Simply put, to make things easier. We want to streamline the process, reduce errors, and make sure members get timely care and providers get paid without unnecessary delays. NOEs must be submitted within 5 days of the hospice election date. That is a strict requirement. Submitting late can result in delayed or denied payments. And here's the critical part. If an NOE isn't submitted, the 900 code, which is a system flag in meds that allows hospice providers to bill for services, won't activate. No 900 code means no billing, and no billing means no payment. So that's why timely submission it isn't just important, but it's essential. Starting June 1st, 2025, we made a clear distinction If the member is fee-for-service, the notice of election goes to DHCS. If they are in a managed care plan, it goes to the managed care plan. MCP members, NOEs, will not be processed by DHCS. You need to verify the member's eligibility on the date of hospice election. Use tools like MEDS or automated eligibility verification system, otherwise known as AEVS. And remember, use the DHCS 8052 form only, which is on the DHCS hospice information webpage for you to download. Submitting electronically is preferred. It's faster and reduces the chance of errors. The 8052 form has been effective since January of 2024. While some providers may still be unfamiliar with it, this form has been required for nearly 2 years and is essential for documenting hospice election for Medi-Cal fee-for-service members. Also, be sure to include hospice local contact information for each provider to ensure timely communication. Avoid using general or corporate level contact details as they may delay issue resolution. We are planning to phase out paper applications over time as we move towards a fully digital process. An all-plan letter, APL, for those of you who may not be aware, is an official policy communication issued by the Department DHCS to Medi-Cal managed care plans. All plan letter 25008 was published in May of 2025. It clarifies the MCPs are responsible for managing hospice services for their members, just like DHCS does for fee-for-service. It also aligns everyone with CMS requirements and emphasizes the importance of timely NOE processing. 25008 introduced a more structured and accountable process for submitting hospice election notices, which directly addresses the root causes of past payment delays. This change isn't about policy, or isn't just about policy, it's about your day-to-day operations. You'll need to train your staff to check eligibility and route NOEs correctly. Build workflows that support timely submission and double check that you're sending the form to the right place, DHCS or the MCP. Mistakes here can lead to payment delays or even claim rejections. Reprocessing past claims can be a lengthy process and create significant delays. So here's what we want you to walk away with today. Know where to send the NOE, submit to DHCS for fee-for-service members only, and to the managed care plan for managed care members. Submit within 5 calendar days of the hospice election date. This is a firm requirement. No notice of election means no 900 code. And without the 900 code in meds, hospice providers cannot bill for services, which means no payment. So now is the time to update your internal procedures, train your teams, and start building relationships with your managed care plan contacts. And one important point, most of these requirements aren't new. They're a reiteration of existing hospice submission policies. What's new is the emphasis on consistency and accountability across all delivery systems. DHCS is committed to working with providers to make this process easier, clearer, and more efficient. We truly welcome your input as we continue improving the process together. We know this transition comes with a learning curve, so we've updated our guidance documents to reflect the new process. Plus, you'll have direct contacts at DHCS and each MCP for support, which we'll provide at the end of the presentation. This section is all about the new online form, how it works, and what's different and how it benefits you. Oh, just a FYI, I'm getting some notes that some people may not be able to see the webinar slide deck, and if not, that's okay. We're going to go ahead and send out updates at the end of the meeting, so don't worry about it. We'll go ahead and get it out to everybody. So introducing the new hospice election online form. It's built around the DHCS 8052 form that you're already very familiar with. But this version is modern, intuitive, and designed to make your work a lot easier and your submissions a lot faster. It's all about simplifying compliance and streamlining the process. Instead of filling out a paper form or a static PDF, This online version guides you through each required field in a clean, user-friendly format. There are built-in checks to make sure nothing gets missed, no blank fields, no incorrect dates, no incomplete signatures. That means fewer errors, less back and forth, and fewer denials. Once the form is complete, it's automatically routed to here at DACS. So there's no more downloading or attaching or emailing. It's all handled for you. It's faster too. So what used to take several steps can now be done in just a few minutes. No printing, no scanning, no emailing. So really, it's just a new form. It's a big step forward in making hospice care administration more efficient, accurate, and user-friendly. Some key updates that will help hospice providers prepare for and adjust to the new digital online hospice NOE form and process are that DACS plans to allow for a 90-day transition period following the implementation of the form and process. Hospice providers must submit the online notice of election within 5 calendar days of the election date. This ensures timely activation of services and avoids payment delays. NOEs must be sent to either DACS or the member's managed care plan, depending on the member's coverage. This will prevent misrouting and ensure faster processing. Online forms submitted to DACS for a member who is part of an MCP will not be processed. NOEs must accurately reflect the actual date of patient-elected hospice care. Backdating is not permitted as this ensures transparency, reinforces provider accountability, and aligns with CMS compliance standards. To support timely reporting, the online form allows election dates to be entered up to 5 calendar days in the past, but no further. So here's what the rollout will look like. The online form is available now for optional use. So it was published in the beginning of November. So then after a 90-day transition period, it becomes mandatory. That means no more emailed or paper submissions. Everything will go through the online system. This gives everyone time to adjust and get comfortable with the new process. And after the 90-day transition period, all NOE submissions must be made using the official online form. Any NOE submitted via email or paper will not be processed. And to protect patient privacy and comply with DACS protected health information policies, all paper or emailed NOEs received after the transition period will be securely destroyed. This ensures that no unprocessed PHI is retained or mishandled. All right, so now let's go ahead and walk through the online form together section by section. I'll highlight what you need to know to fill out, why it matters, and a few tips for making the process smoother. Remember, the new online form is an electronic version of the DACS 8052. It's virtually the same thing. One important thing to note before we begin, the online form must be completed in a single browsing session. That means there's no option to save your progress and return later. So to be sure you have all necessary information ready before you start. So let's start with section 1. This is all about the patient. You'll enter the recipient's full name, Medi-Cal ID, date of birth, contact info, and full address. This section is critical because it links the form to the correct Medi-Cal record. Make sure everything is accurate, especially the ID number and address, to avoid delays in processing. Remember, if any incorrect or invalid information is entered in the form, it will be automatically rejected by the MED system. So please double check all entries before submitting to avoid delays or denials. Next up is section 2, where you'll enter your hospice agency's information. That includes your agency's name, NPI, and contact details. This helps DHCS know exactly who's providing care and who to contact if there are any questions. Again, accuracy is key here, so especially the NPI. In addition to the NPI, providers should also have the following identifiers ready for data entry into the form: CDPH license number, Medicare certification number, Medi-Cal provider number. These are essential for validating provider eligibility. This section is where the recipient or the legal representative initials each statement to understand what hospice care means. These statements cover everything like terminal diagnosis, the shift to palliative care, and the waiver of certain Medi-Cal services. It also explains the right to revoke hospice at any time, and this is about informed consent. So take the time to make sure the patient or representative understands what they're agreeing to. Remember, DHCS requires that the election be documented and submitted on time, but does not dictate the setting or method of obtaining the consent. That is left to the hospice provider's discretion. So as long as it meets the compliance timeline, so hospices should continue to follow their established procedures for obtaining informed consent. When a provider clicks the signature portion of the NOE form, they are testing that all necessary consents have been obtained. This includes confirming that the patient or their representative have been fully informed and that all required approvals are in place. By submitting the form, the provider affirms compliance with all applicable consent and authorization requirements. Section 5, part of the form, we're capturing some key clinical logistical details about the patient's hospice admission. First, you'll need to enter the admitting terminal diagnosis, along with any related conditions using the appropriate ICD-10 codes. This helps ensure the patient meets eligibility criteria that services are tied to in the terminal condition. Next, you'll indicate where the patient is being admitted from. There are 3 options: from medical facility like hospital or SNFs, from home, or as a transfer from another home hospice agency. This information helps us understand the patient's care setting and whether there's any overlap in service providers. Some of these fields are optional, not all are required. Definitely attending physician and NPI are required. Anything that is undone, a field will be flagged before you're able to proceed to the next section. The recipient or their legal representative has the right to choose an attending physician. You'll need to document that physician's name and NPI number. However, if the patient does not have a separate attending physician and is choosing the hospice physician to serve in that role, there's a certification statement they'll need to initial. This confirms that the hospice physician is acting as the representative, as the attending, and that the patient or representative understands and agrees to that. This section is all about clarity and consent, making sure the patient's care team is clearly identified and that there's no confusion about who's responsible for their medical oversight. Oops, excuse me, sorry. Section 5 is important for identifying any other services the patient is receiving before electing hospice. This helps prevent overlapping care or billing issues. You'll also confirm the agency's CDPH license number and NPI again here. This section supports transparency and ensures the patient's care is coordinated properly. So this final section is where everyone signs off. The recipient signs to confirm they understand and agree to elect hospice care. If they can't sign, a legal representative can do so on their behalf, and they'll need to include their relationship to the patient. Finally, a hospice representative, someone in a leadership or licensed role, must sign and date the form. Just make sure the form is submitted within 5 business days of the election, or 5 calendar days of the election. To reiterate, DHCS requires that the election be documented and submitted on time, but does not dictate the setting or method of obtaining the consent. That is left to the hospice provider's discretion as long as it meets the compliance timeline. Once you've completed this section, simply submit the form. Be sure to click Save a Copy for your records or email our hospice coordinator for a copy. So we know that this was a lot of information, and we know that transitioning to a new system can come with questions. So we've set up dedicated office hours just for you guys every Monday from 12 o'clock to 1 p.m. starting December 1st. You can join us live on Microsoft Teams for real-time support or with the new online hospice form. It's an open Q&A format, so whether you have a quick question, need help troubleshooting, or just want to listen in, you're welcome. And the best part, there's no appointment needed. Just drop in anytime during the hour. We're here to help however we can. Your input is incredibly valuable. So if something isn't working or could be better, we want to hear from you guys. This is a collaborative process, and our goal is to make the form as user-friendly and efficient as possible for providers like you. The link to the Microsoft Teams office hours will be going out on Monday. So everybody should get a copy of that. And we have your email address, and so we can send out a link if you want it, and we'll put it in the Q&A for you to grab. We also have a collection of resources and information pertinent to Medi-Cal hospice services. We hope these links will serve as valuable insight when you have questions, and all this will be available to you on the DHCS Hospice Information webpage. So feel free to email us at any time at the mchospiceclerk@dhcs.ca.gov. We'll go ahead and put it in the chat too, so don't worry about it if you didn't grab that down with any additional questions. We're here to help. So as we conclude, I invite any questions you may have. This is an opportunity to clarify any uncertainties regarding the new online submission process or any other related topics. Your engagement is crucial as we work together to ensure a smooth transition to these requirements. Feel free to drop your questions into the chat or Q&A box if you weren't able to find the Q&A box. We'll start to address as many as possible in the hour. And don't worry if we don't get to your questions. We'll take all the remaining questions and update our FAQ page online for you to view at a later point. So we'll go ahead and start to look at the questions and try to answer them as much as possible within the remaining time.
Nate, this is Erica. I think we should probably start at the top of, you can start with the Q&A if you'd like, and then we can start at the top of the chat and work down. I think it might be helpful, maybe Nate and Florida, if you could just level set that this new online notice of election form is essentially a digital version of the prior paper form. And so all of the component parts and the fields that are being filled out are the same as were previously filled out. And so there really shouldn't be any changes in terms of the information that you were previously including on the form. So if we could maybe start with that, Nate and Florida, I think that would be helpful because there's a lot of questions around some of the fields in the form. So if we could start there, I think that would be good.
Sure. Yeah, sure. So just to reiterate, from the slide deck, the new online form is almost an exact copy of the DHCS 8052 PDF that most providers should, or all providers should be utilizing now. It was just taken and basically digitized. So the form is almost identical in nature. So there should be no changes, no different fields, nothing new. The only requirement now is that you're not able to submit the form without all information, such as NPIs, CCNs, Medi-Cal identifying information for Medi-Cal members. So that nothing new about the form other than the fact that it's online.
Right, and it's helpful to have, when filling this out, to have the CCN number, Medi-Cal number, the CDPH license, and Medicare number available, so you're not running around. So it's just, preparing all your documentation before you're filling it out.
Thank you, Florida. So we'll go ahead and try to start answering. Let's see. I'll do my best to start. Again, don't worry if we don't get to your question today. We're going to go ahead and take all questions offline, and we'll compose responses, and we'll get them all out to everybody. We have everybody's information, and we'll also post it on the DHCS Hospice Information website. So don't worry if we don't get to your question today. We will definitely get responses out to everybody. Let's see.
They're asking if this will be recorded. This is recording, so yes.
Sorry, I'm just going through the questions.
There were a number of questions on 5 business or 5 calendar days. If you look at the chat, I think that's been answered.
Yeah, to reiterate, so apologies if that was confusing, that those are 5 calendar days. There's one question from Armin. The CCN field format requires a 1-letter and 5-number format. For the 50% of hospices in California with CCN that consists of only 6 numbers, what should be entered in this field? So we did have an issue with on the form in that field. It did not allow a CCN that did not have a letter appended at the beginning. We have since changed that. So now the field will allow for up to, I believe, 6 numbers, any alphanumeric sequence now. So that should no longer be an issue because we do realize some providers do have a letter at the beginning of their CCN, and some do not. So from now on, you are able to enter that field without any issue. How will the patient sign the form if it's online? If the office staff is the one filling out the form. So again, DHS does not dictate that at this time. We dictate the timely submission of the form. We anticipate that hospice providers will continue with their protocol on how they've been doing things. That we do realize the form needs to be submitted in one browsing session. So if you do have the required attestation verbal from the member, the coordinator can fill out the form. But again, DHS does not decide on that. Let's see. There is no API available at this time. I will say that DHS is working on a phase 2 solution that will be a little bit more robust and better, but that will be rolled out long-term. That's a long-term plan of ours. So for now, this form is a better solution than the current PDF that most providers are using. But yeah, there is no API available. Lucy commented, MCPs are not aware of this. When I ask how to send the election, they do not know what I'm referring to. How do we proceed with this? Feel free to reach out to the hospice coordinator if you are encountering these issues. We do have MCP hospice contacts that we can contact to assist providers to get the NOE to the correct managed care plan and managed care contact. They are aware, but as I stated with the APL 25008, they need to be aware and they need to be able to receive NOEs. But please, if you have any questions regarding this, feel free to reach out to hospice coordinator and we can and coordinate offline to get you the correct contacts for specific MCPs. Again, patient representatives that live out of the state, how do they sign the web-based form? It's a form information cannot be saved or sent to signature. Again, DHS does not dictate how that is done. We just require timely standards of submission of the form, verbal consent, or how you've been doing it prior to this form rollout is acceptable.
There is a question in the chat, and I think that I saw it a few times around what happens if folks submit after the 5-day window.
So the timeliness standards required for the form are 5 days or less. The form will not allow you to submit for further back than 5 days. So the time that you submit the form is when you are able to bill. So the 5-day requirement is very strict. So if the standard, if the election starts after, or the submission form is submitted after 5 days, that is the earliest point at which the provider may be able to bill.
And the start date is the date that the member signs the NOE.
Correct. So when submitting the form online, the election needs to happen, or needs to have happened in less than 5 days or less.
That's the effective date is the date that the member signs the NOE.
Let's see. What if there is no connection at the time someone is filling out this form? How would this be completed if it can't be saved? Just saying connection issues occur all the time. Yes, we definitely realize that, and we know that is an issue. However, after the member has elected services, the provider has 5 days to submit the form. So that should be more than enough time to submit the form electronically, like the provider coordinator. So the form does not need to be submitted exactly when the election date occurs, like the first day. You have 5 days.
There's a question that said, Samantha Keys like to know what to do when we don't have a diagnosis ready at admission when signing. Actually, a certification of terminal illness from the physician is required. So we need to know, I mean, the hospice should know that a terminal diagnosis has been determined and there's a certification that's required in your documentation to maintain. So you need to have that diagnosis before you fill out this form.
Sorry, just going through the questions.
You want to acknowledge, Nate, there's a whole bunch of questions related to individuals who are duly eligible, where Medicare is the primary payer and Medi-Cal is, for example, only covering room and board. Not sure if we have the right folks on the call today to address, otherwise just want to acknowledge and we could take that back, but just wanted to
Definitely.
check with, yeah.
Yeah, we'll go ahead and take that back.
Well, if the question is whether they need to submit an NOE, yes, they do submit an NOE. Because then we know for sure that they're they may have Medicare, which someone has mentioned, that is the primary, and then secondary is Medi-Cal, and we do cover room and board. But an NOE is still required for the Medi-Cal member who chooses hospice.
We do realize there will be some exceptions, especially around transitioning from a managed care plan to a Medi-Cal fee-for-service. In those cases, if you believe that there is an exception, you can always reach out to our hospice coordinator who's here to help still. So that does not change as far as having communication with the ACS. If you do believe that in some circumstances an electronic form is not appropriate and you need to email, please feel free to email our hospice coordinator, Lisa. She's very approachable. We have email address on the website, so it's very easy to reach out to us, and we're able to get back to you as quick as possible. The paper format is currently acceptable, but we anticipate after 90 days, they will no longer be acceptable. And we will only transition to the online form. DHS will issue communication when that does occur. So we'll give you more than enough time to transition.
Can you clarify?
Go
There's
ahead.
sorry, there's a lot of questions about the timeline. So 90 days from what date, so they can know the date certain for.
So I'm sorry. The notice of election online form was published in the beginning of November, approximately November 1st. So 90 days started November 1st. We issued communication to Medi-Cal hospice providers, and we will issue more. And feel free to visit our DHCS hospice information webpage. We'll go ahead and put that in the chat later. So you can get all of your information from that resource. But they do, or we do issue communication through Medi-Cal provider bulletins and news flashes. And so those will be going out in the next about approximately 60 days for a transition. Let's see. So again, the 90 days is a period in which we are accepting all NOEs, both paper, PDFs, emailing to the hospice clerk, and in the notice of election, the online form. So this is the time we recommend you start using the online form to get used to it, but you do not have to at this point. So let's see, I'm just. So so what if the late submission of the NOE has already happened? Are there exceptions for the ones that were submitted before the official announcement? So late submissions, there are no late submissions allowed. It's a requirement that is 5 days. So that's not changing. But the official announcement is more towards our transition to the online form rather than if we are accepting late NOEs. If a patient revokes, no, I don't know, revokes and comes back, do we need to complete again and resubmit? Florida, do you want to answer that question?
Oh, I'm sorry. Can you repeat? I was answering
If a
text.
patient revokes hospice services and comes back, do we need to complete again and resubmit?
Yes. If they are transferring, no, like from one facility to another. But if there's revocation, then yes, they have to resubmit an NOE.
Let's see. Online forms are currently being accepted now. The form was published in November 1st. So we will provide a link in the chat for you to use, but it's already on the DHCS. Feel free to Google DHCS hospice information, and it will take you straight to that page, and then you'll see a link to the form and all information. We have an FAQ set up. We have the DHCS 8052 form, which can still be utilized. We have a link to the new form, online form that can be used now, and any other resources that you may need. So that should be your main resource page for all of this information. But we'll go ahead and put the links in the chat too by the end of the meeting.
There are a couple questions that have to do with revocation. It has not changed. If there are revocations, it needs to be written in email and sent to DHCS via the hospice clerk email system. So any revocations need to be sent to us in writing to let us know that the patient and family have decided to revocate. I'm sorry, Nate.
Yeah, it looks like Sheila Clark from Chapka kindly put in the DHCS hospice information page in the chat. That is the main resource for everyone to use. Everything that we're talking about today is on that page. It's pretty self-explanatory. The form, it's a one click. It's right on the main page. There's an FAQ, and there's a lot of information, including our Lisa, our our hospice coordinator's email address, so you guys can reach out to her. If need be, it's all on that hospice information page. Thank you, Sheila.
Yeah, thank you. She also put the APL, which is great. Thank you, Sheila.
Here's a good question. I'm hearing that we do not need to use the paper form in the home. Can we do this via paper in the home and then submit the NOE by admin in the office within 5 days? That's correct.
We do need signatures though.
Florida, this one might be for you. What if a Medi-Cal hospice patient does not go to a SNF for the first 3 weeks of hospice? Do we backdate in the MCL election to original hospice start date, or date members goes to SNF?
I need to read it because I can't.
Okay.
I need to find it.
We'll go ahead and take that. We'll take that
Yeah,
back.
we'll take it back and we'll get back to you.
Yeah. Where can we see the 900 code? Most providers, if not all, should have access to a read-only system of meds to check member eligibility and whether or not they are eligible for hospice services in the form of a 900 code. Does the 90 days end February 1st? No, we anticipate it ending the end of February. We will issue more communication as that time gets closer.
And to put a finer point on that, Nate, I do, and keep me honest, but I do believe we plan to issue approximately a 30-day notice in advance of the date we'll no longer submit paper forms, and so there will be a date certain. But the idea here is to get everyone sort of familiarized with the new process and get you all starting to use it, so that way when you get that notice, you'll have started the transition process, and hopefully it'll go a little bit more seamlessly. I do also want to underscore, because there are a ton of questions about just patient consent in general. And so I know we said it several times, but I just want to say it again. We at the department are not going to dictate how our hospice providers choose to obtain and document informed, patient consent or legal representative consent for purposes of completing the NOE. Some of you suggested that you would like to continue using like a paper process to do that, and I think that would be fine. My one sort of overarching comment is that you have to do all of that before you get into your session to submit the online NOE. And then I would also just, again, our policy will articulate this clearly as we're working on some refinements to the provider manual, but you should always be maintaining documentation of patient or legal representative consent in the member's Medi-Cal record that is available both to the department upon request, as well as in the event of a state or federal audit. So I just want to be very clear about that as well.
Or just want to let you know, so a 60-day communication will be going out at the beginning of December. And we will issue another 30-day communication probably towards the end of January. So there will be plenty of communication for this transition for you guys to have plenty of time. But we do suggest you start using the online form when possible, so you guys can get used to it.
There's a question. Back office staff signing for the patient. There should be no signing for patients. If the patient is unable to sign, then there should be a legal guardian available to sign, and that's in the form. So back office should not be, no one should be signing for the patient. If the patient is unable to sign, understanding the hospice services, then the legal representative should be signing.
Another good question. After we submit, will there be a confirmation sent back that it was received? That's a good question. After you submit the form, there will be a button immediately after you submit that asks you if you want to download a PDF of the form. So that's very important. If you can download that form after you submit it for your records, that would be a lot easier for you. Otherwise, if not, we have copies of the form, so you would just reach out to our hospice coordinator if you needed a copy. But there is a notification for you to download the completed form when you submit the form. So another good question is, if the paper form is signed by a patient or legal guardian or representative, is it okay if the admin enters this information via the online form? And that's correct. Yes. Another question. Oh, sorry, I lost it. Another question. If we have verbal agreement from a patient or representative to submit on their behalf, is it okay for someone else to complete and submit the online form? The form has patient signature lines, so how is this able to be handled? Can we write per signature on paper consent form or something like that? That's correct. So DHS does not decide how that is done. But we do require that the submission form is handled online, or we will require that the submission form is submitted online after the 90 days. Hospice providers are required to have a verbal consent or written consent on file.
And we'll be able to put this more in writing, because it's sounding like there's a lot of people that are talking about, legal guardians being remote or out of the state. So we're going to put something in writing, to answer those questions.
Yeah. One question from Amanda Bell is, what is the process when Medicaid is approved retroactively? We've had 2 cases this week in this situation. I assume that there will be a leniency on 5-day rule when having it turned in. So in these cases, these are exceptions. So please reach out to the hospice coordinator if you believe that the 5-day rule is not acceptable. So we can go ahead and take that, because we can look at each case on a individual basis.
And I think it's worth mentioning. So, and I see a lot of questions about retroactive eligibility and dual eligibility. You know, the transition from a paper form to an online fillable form, we are not changing any other policies
Mhm.
associated with how hospice services are currently reimbursed. And so all of the same policies specific to how retroactive eligibility works today would continue to work the same way going forward with the electronic version of this form. So do just want to be clear that the only policy change that we are discussing is specific to transitioning from a paper form to an electronic version of that form. If that's sort of helpful for folks to understand kind of what is changing and what is not changing.
I think we have time for a couple more questions and then we'll go ahead and close out. Let's see. And again, all these questions that we were not able to get to, especially around signing electronically and retro Medi-Cal, don't worry, we'll go ahead and get them out there to you pretty soon. We'll get responses out to all of the attendees today. I'm seeing a lot of the same questions. So we'll go ahead and take those back and we will
We'll address them.
update. I'm sorry.
Yeah, we will get back to you on answering these specific questions because there are a lot.
We will be issuing more communication coming soon with those Q&As. So please look out for your email that you signed up with in this meeting. We'll go ahead and send a link out so you'll have access to all of the questions and responses to those questions. We want this to be a smooth process, and I understand it's a little confusing right now, but really I assure you that it will not be super confusing. But we will go ahead and clear all those questions up with clear answers.
I do just want to acknowledge, Nate, because there's a lot of questions kind of about our hospice policy kind of broader than the new NOE form. And this will become more apparent, but we are actually working to make some refinements to our written policy and the provider manual specific to hospice services. And so a lot of the questions that are being asked are totally reasonable in terms of historical practice for how things work under our policy. And so hoping to definitely provide some additional clarity through those provider manual refinements. So more to come. But just wanted to share that is in flight as well, and it's kind of separate and apart from this process update.
So again, just want to thank everybody for attending today. I know that this introducing a new form can be a little difficult at times, but really this introduction of the form is merely the same form that we currently have online, that is a PDF. And so we're trying to streamline the process to help you all better, make the process easier and more streamlined. So we're going to go and take these questions back, get answers for you. We'll send them out within probably right after the holidays. We'll have something in your inbox or the hospice information webpage. So we'll definitely communicate that out to everyone. But we want to thank everybody for attending today. And we hope you have a great holiday. Thank you very much.
Before you end, please make sure you save the chat and the Q&A.